Coronary artery disease is one of the leading public health problems in Europe, causing almost 20% of deaths. With time, this condition can lead to a cardiac event, such as a myocardial infarction, resulting in damage to the heart muscles. After a cardiac event, the patient needs to start a cardiac rehabilitation therapy to regain the physical function. Cardiac rehabilitation is a multidisciplinary therapy that includes aspects such as nutrition, lifestyle changes, and weight management, although the core of the therapy is physical exercise. The rehabilitation process starts during the hospitalization for the event and can continue in an outpatient setting after discharge. However, the referral rate to these services remains low, especially in rural areas. Alternatives to center-based rehabilitation include, among others, home-based and internet-based programs, in which patients can follow the rehabilitation therapy and still be under the supervision of the medical team. HeartWays system implements a closed-loop cardiac rehabilitation service based on physical exercise addressed to patients outside a medical setting. The cardiac rehabilitation starts when the medical team prescribes a training therapy, which is delivered to the patient in the form of exercise sessions. With the information collected during these exercise sessions, the medical team receives feedback, which is used to assess the health status of the patient. This process can be described in a double care loop. The outer loop is controlled by the medical team from their workplace. The inner loop represents the therapy delivery and the patient's self-care outside the clinical setting, normally at home. The crossing points between both loops represent the changes in the therapy, which modifies the behavior of the inner loop, and the feedback events, which allow the outer loop to close the iteration. HeartWays supports all the stakeholders involved in the cardiac rehabilitation process with a set of tools. These tools are HeartWays for doctors, HeartWays for nurses, and HeartWays for patients. Cardiologists can manage the patients currently in rehabilitation through HeartWays for doctors. It contains a list of all the patients enrolled in the cardiac rehabilitation program. From this list, the doctor can prescribe a physical exercise therapy. By default, the system provides a template, which contains a predefined program. However, plans can be created from scratch combining activities during a temporal window. The default template used is based on recommendations from international cardiology and exercise institutions. It implements an intensification strategy, which increases gradually the exercise requirements in terms of intensity, duration, and weekly frequency. Nurses have their own tool to handle patients, HeartWays for nurses. It allows then searching for a specific patient and further personalizing the prescription for strength activities. Nurses can create training sessions by selecting specific exercises from a list. They can select the level, the number of sets, and the number of repetitions. These values are adjusted to each patient to make sure the exercise intensity is adequate. The tool also allows creating new exercises. The nurse just needs to fill in the descriptive fields and annex an image with guidance on how to perform the movements. The third element in the system is HeartWays for patients. Patients use a set of devices to do the exercises that the doctor prescribed and the nurse personalized. HeartWays provides 3 different packs: a pack for endurance exercises, a pack for strength exercises, and a special pack for remote ECG monitoring. The pack for endurance training contains a smart T-shirt, a heart rate monitor, and a mobile device running HeartWays software. The smart T-shirt integrates textile sensors woven into the shirt itself that record the electrical activity of the heart and the movement of the chest. Attached to the T-shirt, an electronic device processes the ECG to extract the heart rate and the chest movements to measure the breath rate and the breath amplitude. The prescription created by the doctor is automatically transferred into the device when there is an internet connection available. When the patient starts a session, it connects to the electronic module in the T-shirt and uses the data acquired to monitor the patient and provide guidance based on the prescription. A special guidance algorithm processes the parameters recorded and detects when they are outside the prescription boundaries. The mobile application will then automatically ask the patient to adjust the intensity. When the exercise session is finished, the patient can use the mobile device to report any symptoms experienced while exercising. The pack for strength exercises contains a set of sensors that control the movement of extremities and a glove that monitors the oxygen saturation during the exercise. The pack is complemented with a PC application that receives the data recorded by these sensors. This application receives the strength exercises prescription personalized by the nurse and gives the patient guidance on how to perform the movements correctly. When the exercise is improperly done, a red flag is displayed on the screen. The third pack is used in cases when the patient requires a closer follow-up. With the HeartWays multi-lead ECG monitor, doctors can get a live ECG signal, which is plotted at their terminal, to analyze the morphology and visually identify arrhythmias. The cardiac rehabilitation loop is closed when the information recorded during exercise sessions is transferred to the professional side of HeartWays. That information is added to the patient's health record and is used to run a set of algorithms that assess the physiological response to the exercise, predict the evolution of cardiovascular risks and check the overall adherence to the cardiac rehabilitation program. When these algorithms are executed, the patient list is automatically sorted based on the stratification strategy. Those patients with a higher risk are displayed on top, so the doctor will always focus on those patients that really need a more urgent attention. The doctor can access to the exercise data and analyze the information recorded during the session. The system automatically overlays a color-coded background to signals that represent the original prescription. Similarly, nurses can check the exercises done by the patient. Exercises are assessed with an exercise completeness index and an exercise quality index which indicate how well the patient performed. Patients also follow their own rehabilitation process. They can see their prescription, they can see the results from a session finished, and they can also access to educational contents that complement the aspects in the cardiac rehabilitation program that are not directly related to physical exercise. With HeartWays system, cardiac rehabilitation programs are easier. Patients can follow the rehabilitation at home without need to move to a specialized center. They have the assurance that their system is monitoring their vitals and guiding them to maximize the effects of the exercise. This way the recovery process can be shortened and they can resume their daily activities sooner. Additionally, health professionals can make a closer follow-up of their patients, as they can see what the patient is doing. If the patient is worsening, HeartWays will show a cardiovascular alert and they can react on the treatment before the patient has another cardiac event.